lot of criticism, punitive. It's an I, you, us, them kind of. So, autocratic leadership is not bad, particularly in a crisis. When you have a crisis, you need somebody to take control, be command. In healthcare, we talk about that as in a code. Patient codes, heart stops, breathing slows or stops. You need somebody in charge. You can't be like, anybody want to decide what we're going to do? Should we vote? Anybody want to decide how many joules of electricity we shock them with right now? No, you need to have a command, decision, authoritarian leader. Unfortunately, in healthcare, we always say that's the doctor with the longest jacket, and he may not be the smartest guy in the room. So, but he's the guy who is in the room, and for us nurses, sometimes we tolerate that, and we just save the patient, and then we figure out how to say we're sorry later. Glad he earned his jacket. Yeah. So, democratic leader, less control. So they take opinions, right? So this is thought to be the best type of leadership because we involve other people. We're very committee, council structured. We make decisions by we, and so. Seems good, but once again, there's a time and a place for this type of leadership. And generally, you want engagement, you want involvement, you want people to have a voice. So not a bad thing. Laissez-faire. So this is that leader that just kind of is, less control, no clear direction. Great manager, by the way, because you love working with them because they don't tell you what to do or when to be there. And if you do something stupid, they're not down your neck. And people are generally pretty happy working for these kind of people unless you actually need something done. Or your coworker is lazy and you have to do all their work and the manager is not managing or leading or you don't know what they're doing. So this can be a little bit of a challenge. I actually think that transformational leadership is a nice combination of all those because every one of those styles, and those are kind of the big three styles, they have positive qualities. And in certain situations, even laissez-faire. Hey guys, we have a project. Get out there and figure out how to do it. I'm not going to tell you. You guys are all smarter together, so go figure it out. I'm not going to give you any direction. The truth of the matter is millennials love that style because you are very creative. And if somebody tells you exactly how to do something, it is just infuriating. It's like, well, then why did I get up and have to think? If you're telling me exactly how to do it. And so creativity and innovation is thriving with your generation, and we love that. Those of us who are kind of stuck in this is the way we have to do it because Joint Commission tells us this, and there's regulations, there's rules, there's laws, and I don't want to go to jail. There's lots of things that kind of say we have to do it this way. And the younger generations kind of say, jail. I don't know anybody in my family, okay, one, that went to jail. So it's likely it's not going to happen to me. So you just kind of are not really concerned by those kinds of idle threats. And so you kind of move beyond just the simple innovation. So I don't know if this is going to work. If it's not, I will not act it out. But, looks like it's going to work. Will we have audio?
Leaders make today worse for everyone by using coercive power. Transactional leaders make today better by rewarding with performance. In contrast, transformational leaders are focused on making tomorrow better. They do this in 4 ways. Firstly, vision. Transformational leaders create a noble vision to work towards that inspires others. Secondly, authenticity. Transformational leaders are authentic in their commitment to the mission, not just to personal gain. Their integrity inspires the team to take action. Thirdly, a growth mindset. Transformational leaders cultivate their team's professional and personal development. They invest time and energy, knowing their effort will eventually bear fruit. And they recognize both the individual's effort as well as their performance. And finally, creativity. Transformational leaders encourage team members to develop ideas, work with flair, and embrace originality. They allow measured risks, which helps to foster a culture of innovation. In short, teams with transformational leaders are constantly being transformed for the better. To review, transformational leaders work towards a noble vision, act with authenticity and honesty, adopt a growth mindset, and promote creativity and new ideas. Download this HD video.
I'm so impressed that worked. And I was not worried if it didn't because it's kind of corny, but whatever. So, you understand transformational leadership a little better?
That's cool.
What is it that makes a transformational leader or transformationalism better for healthcare, for any situation?
I really liked how the video talked about how it's all about tomorrow. You know, today we're gonna have a lot of things go wrong, but you know, let's try to make sure that tomorrow is better than today.
Yeah. Progressive.
Yeah.
Forward thinking. That vision. Your vision is not about here, right? Vision is always forward. So having that vision, you'll have a hard time finding, if you had to make some assignment, mission statements, vision statements, values.
Mm-hmm.
It's kind of, but there's organizations who have a mission, a vision, mission, and values that really are connected and they live them. They're not just a plaque on the wall. People in those kinds of organizations actually know them. You walk up to an employee and say, what's the vision statement for this organization? They know. And I would challenge you to see if there's many people who know the vision statement, John Juice, or wherever you go. They have one, I'm sure, and back at corporate headquarters, it's big somewhere. But if you're gonna have a vision statement that says, this is the vision, or this is my mission statement, you've got to make it simple so people know it. You've got to live it. And then those values too. Organizations will always have 4 to 10 values, and they're supposed to resonate with every individual in the organization. Well, that's great if it does. And certainly we want to work for organizations that those values or pillars are really resonate with us so that we feel value. So, but transformational leaders have the vision. So they have a vision. Go ahead.
Another thing that I really liked was how they all worked better together and they were able to do more using everyone's strengths rather than him just being like, oh, well, this is my idea, therefore it's the best. Yeah.
Transformational leaders generally surround themselves with really smart people, which is a really good idea in leadership. Christ, they were fishermen and other professions. I should know them all. But, part of surrounding yourself with good people, right? Good people who are willing to follow, good people who are innovative and creative, because otherwise you are doing it all yourself. And that can be challenging. You've all been in work groups in school where you pull more than your weight. You've been in others and you're going, oh my gosh, I am so glad they know Excel, and they know it so well. And so you just have to find those people. Knowledge, you got it. Go ahead.
Oh, no, you can.
Knowledge is obviously you got to know what you're doing. You can't just wing it, fake it till you make it. That works occasionally, but not often enough, and particularly not in business and not in healthcare. Healthcare is very, very complicated. I was just talking to our chief financial officer telling me I was coming down here, and I said, we don't know even close to what we need to know to run a healthcare organization. It is so huge. And that's why we have those 80 leaders. They're experts in their field, and we rely very heavily on them. But you have to have a fundamental knowledge base of how things work within an organization to make it work.
I was going to actually comment on I am having a brain fart. Next one down. Charisma. Yeah. Every leader, everyone that I've ever looked up to has always had charisma, something about them that makes them unique, and I can trust them because they're authentic.
I don't know that authentic and charisma are the same.
Oh.
But charisma is just that appeal. And I'm sorry, I'm a short, fat, balding white guy. I know many of you came tonight and were like, you were expecting more. Well, I used to be more. I've been in healthcare for 30 years. I used to be taller and had more hair and was thinner, and it just doesn't work that way. But there is that, and every one of us have charisma. This is one of those challenging ones when people talk about that characteristic, because I think innately most of us go, yeah, we're not as charismatic as them. And the truth of the matter is, all of us have our own level of charisma. And it just is that comfort level with yourself and being able to be upfront and be that leader. I mean, that's the challenge. It's remarkable to me how many CEOs I've met that don't like being up in front of people. And I'm like, how did you get to be the CEO of the company? And there's all these people that follow you, but you don't like to be up in front of them. It's weird. They're usually just really bright people, and they've got those smarts, and they figure it out, and they surround themselves with people that kind of help defer some of that a little bit. But that doesn't necessarily mean charisma. Charisma isn't that you're comfortable up in front. It doesn't mean you're the most beautiful or handsome person in the room. It doesn't mean you're the smartest or the whatever. It just means that you are unique enough to set yourself apart to appeal to other people in some way. So creativity is huge, though. You've got to be creative in maybe it's not you making all the creative decisions. It's creative enough to say, run with that. That's crazy. I think you should figure out if that would work for us. And that's creativity in a different way. I have like no musical art talent whatsoever. So I remember one time when somebody said, man, you were just really creative. I'm like, not by my definition. I don't know what I had to kind of get down. What do you mean? And they're like, oh, you just have really good ideas. I'm like, yeah, I have no idea how to do any of them. You know, I think that's creative, is if you come up with something you actually know how to do it. But I think creativity is a broad spectrum. You have to be open to, I've never heard of this being done. And instead of saying, then it can't be done, or, oh, they tried that 10 years ago and it didn't work. It's like, well, let's figure out what went wrong 10 years ago and make it better. So that. And the growth mindset is just that future speaking to. We want to grow. We want to improve. We're not happy with the status quo. And I think that's, sometimes that's innate in people. Other people are pretty chill, pretty comfortable. As long as I've got my show and my remote and my chair, I'm good. So that's growth in a different way. But there are people that are comfortable in that, but there are just people who are curious and not really happy with just things being as they are. It's wanting things to be different and better all the time, which is great for healthcare because things are better and different all the time. There are more products, pills, equipment, every I don't know how often. I mean, there's new stuff every day, right? So there's something new approved, being trialed, tested, approved, by the FDA or other people every single day. And then it's, our job is to try to figure out, okay, is that better than what we currently have, or can we afford it, or can we afford not to do it? So this is your case study. So this is a good time to break, right? So I'm gonna read. Well, I'm gonna actually have Michael do it, or somebody. And then it's pretty simple, but I want you to be creative with this little case study. So I want you to kind of, we're gonna read it, we're gonna get food, we're gonna sit down in 4 or 5 people, and then I want you to come up with the most creative solution you can for this little clinic to make more money or to do better or to solve the problems. So go ahead, Michael.
You are responsible for marketing and development for a small 2-provider clinic in rural southeast Idaho. There are more than enough patients to go around. However, your mix of Medicare and Medicaid patients has hit a level of financial imbalance in your already full patient practice. Contractual allowances with third-party payers are only slightly better, but will allow you the margins you need to continue operating in the black. How could you improve the patient balance and see more third-party insured patients and/or improve the budget with current patient loads for the already full practice?
It's so everything challenging, but people solve it in lots of different ways. So, okay, get food. Come back together. Get creative. I sure hope you come up with something that will help me. No.
Cool. Thank you. It's really similar.
How many of you have I met, like in other settings? Because I know a lot of you, but I'm never ever sure where I know you all from. You're in hospital, housekeeping.
Your door's always locked, so sorry.
Oh.
Yeah, because I have a closed door policy. I'm a Gen X. It's all about me. Sorry, I'll unlock my door. I've never noticed that it's been overfilled, so yeah, good. Thank you.
I've seen you at the hospital a few times.
Yes. Good talk. Michael, I know because he's interning with our quality risk. Any of the rest of you?
I noticed you as well.
Oh, yes, yeah. Trevor.
Yep.
Okay. Very good. Man, so many people look familiar, but I'm not sure what part of my life.
Yeah.
I've successfully avoided any kind of YSA assignment, and that's good.
Yeah.
For now. I know. I hate to say that was
Especially
wrong.
on
To
campus.
throw that out into the universe is just wrong.
They're always listening.
I know. That's why I live in Hamilton. Intentional.
I was gonna say, I'm sorry I'm late.
Oh, no, you're
Oh,
good.
you did? Okay. Yeah, I'm still trying to on the camera.
I saw it was one They're coming from Rexburg. I know. I'm so excited. Right next to my complex. Walking distance, baby. No, I live in. Wait, you lived in Rexburg? I lived here. But I know you're not.
What type of clinic is it?
Thanks.
Well, that's a good question. Just internal medicine, family practice.
It's right here.
That's why their
But I will-
Medicare, Medicaid is so high.
You got a place there?
I worked at a dermatology practice,
It was
and
really funny.
it was so hard because only oftentimes we get only dermatitis calls from Medicaid patients. That's not covered. And so I was a receptionist, so I'd have to ask them, you know, are you experiencing this symptoms? If they said I have Medicaid, and I was like, well, you can still come in, you just have the whole bill.
It is.
All you are. Are you sure this term is something else?
No.
Exactly. Yeah.
I think
Yeah.
they would want it to be cancer, but it's covered.
Yeah, so the physician had to kind of train me a little bit on what to catch and questions to ask. Yeah.
I get you. That's why I used to not have procedures. Oh, it's because the burden was so deep. I was like, I'm not paying. I'm not paying for this.
Oh, yeah, that's so good.
The North Point, like, was it like $9.99? I think they were charging us just something. Yeah. I think it was just for the summer. Because fall, everyone fills up. Probably they have like 6. Probably because
They have different. I think they have
it's too
I mean, we were
Yeah, sure. I don't there's the transportation one, but you're goes up to like 720. I don't you can actually look it up. Because I love the uniform plan. I got to see it.
We don't have to worry about receivables here, right? We're not considering receivables, and the turnover rate.
Well, if we can influence those in a positive way, that would be great.
Yeah.
Trevor, did you look into an internship?
Yes, I actually applied and got it all. We didn't get my immunizations the other day. So, yes, Joanna.
Joanna, reach out to you at all?
Yeah.
She's like our volunteer.
Right. Yeah, she said something about getting my name badge ready or something like that. So
She's moving right in.
I don't even know.
I'm offended she hasn't evolved.
Right? She said that right after I gave her my immunizations. I'm like, okay. She did talk to me, but I'll wait to hear from you and then we'll go from there, I guess.
Awesome. You interning in with them? That's great.
We're hoping.
Yeah, I mean,
Not that we have anything to do with it.
yeah, that's what I would like to have happen, I should say. So.
That's great. That's great. I'm applying for an internship in Portland at OHSU. Hopefully that works out. Yeah.
It's hard to get lots of people willing.
Yeah, that's for sure. Yes, but
I'll get it. I need to show its worth. We have not a lot of pressure. I need to show them that
yeah, but the faculty here, they really encourage us to, like, all right, take these core classes so you understand what's going on before you go out and do your internship. I remember my sophomore year, I said, oh, I want to get my internship done. I was living in Portland at the time. They said, no, we can't prove anything yet because you haven't really taken any of the core classes. So it makes sense.
Yeah, we like that. We've got interns now at the hospital, but if they're going to be administration, we expect them to be juniors.
Yeah, definitely. Well, as far as the payment goes, my wife and I, we figured it's probably going to be better use of our time if I go out there because our families are out there, and so I can stay rent free, just get some travel costs.
Yeah, these internships are
We see each other. You're like, I can't remember. Energetic. That's just
I like this, how like easy it is to find something for you, but like how hard it is to find like that.
Yeah, because the dating scene is so pressured. A lot of pressure. And it's
how did you do this?
I don't know. I've never dated.
Oh, sorry. Someone in here. I was like, oh, you never dated. Yeah, I gave it up boys before I met Susie. So I was like, I swore off boys. And then you got this one. Yep.
All my funny stuff from my roommates I used to live with. Sharing stories.
Yeah, that's what I'm already on, yeah. Like putting a clinic somewhere else. And making sure you yeah.
Did you find out what all the party people like to you just overload the next like that?
Yeah, I think it's like the same thing, but by the way, take your insurance.
Sorry, what was your name?
Like, so like, if I have United Company, but I know that there was some market for it, I'm like, oh, they're paying like,
Hopefully, like I said, I would tell you.
What do you guys think? Oh, at the clinic?
Yeah, find those, find out, yeah, find out. Yeah, they do. I think the problem.
Also,
Do you guys think it's going to be just marketing changes or clinical changes for the revenue?
Well, if they're not going to be, they're going to where the other people do.
Well, if you're in a small rural town, you might just do your clinic and another clinic. And then you know,
Hey, I'm expecting creativity.
they need like a county thing, right? Because you get so much cake from your county. No, from the state. I think it's delegated.
It's like a minute.
I think they do that because healthcare costs are less in the rural area than say places inside the situation here, I think that's charge them we were one of the two people that didn't cause experience that saw people.
And you were in rural areas. You were
We were like a suburb.
I like do.
People had places to go.
Yeah.
They would really know if we not so we did just Medicaid. So the person on Medicare.
Say 1 minute.
Or else, we would use.
I want to allow some time for you guys to ask other questions that are unrelated to this. Okay,
Yeah.
call out, figure it out. Anybody come up with something we'll save this clinic? If not, we're going under. Thanks a lot.
Good to know.
Well, I think oftentimes I feel like people may not understand their type of coverage. One of my biggest concerns is that people will be like, "Oh, I have Medicare, Medicaid. I don't know where to go." I don't know if that would help necessarily with the problem, but just letting people know where they can get their care from. Because if you can, although you may, I don't know if you take a loss from seeing a Medicaid patient or not, but if you increase the volume of the type, perhaps the reimbursement would go up as well.
So Medicare, Medicaid, pay about 40 cents on the dollar. So, we have to up our charges so that we at least can survive off that 40% of reimbursement. And but, certainly you can adjust it, right? So you're saying, well, I don't know, are we losing money if we take Medicare patients? Well, not if we adjust our expenses, right? So there's more than one way to make money. There's actually two. This is good for all of you, you can spend less or make more. This is good for home life balance, and you just have to figure that out. If you're not making your budget, well, you got to figure out how to make more or spend less. And there's only those two ways. So anybody come up with, we're going to do this, and it's going to save us.
So what we thought of is doing like an open house type thing with the doctors, so that people can come meet the doctors and then target our advertising to like wealthier communities that would have third-party providers, because those people will meet those doctors and they'll be like, oh, maybe I want to go to that clinic.
That's certainly marketing and trying to drive foot
traffic.
Yeah, driving people into your practice that are going to have good insurance is important. In independent practices, people call up and say, I've got Medicare, Medicaid. You say, sorry, we're not taking anymore, we're full, right? And they do that all the time. We agreed that this was a internal medicine family practice type clinic, and there's not enough primary care physicians in almost any community. And so, but it's hard because you're a community doc provider, and it feels kind of bad to tell your neighbor you won't see them. And that's the reality of how a lot of these small practices get themselves in trouble, because they just see everything, but they have no idea that the reimbursement is not what it's taking them for the time and the effort, the overhead to see these types of patients. So marketing the right types of clients.
Thinking if you're working with third-party payers, probably tailoring towards them with insurance and stuff like that, to try and create premiums. I would want them to be a part of that, so that they send their patients.
Yeah. You can negotiate with those third-party payers, and the only way they're going to negotiate for paying you more is if they feel like you're going to get better quality. So insurance companies don't want a provider that's going to take lots of care of patients. They don't want to take good care of patients. Like if a patient comes and sees you, we want them to be happy, satisfied, stay out of your clinic, stay out of the hospital. So that's kind of managed care. It was big in the 80s. Everybody felt like every person was going to be managed by a physician. And that physician, the insurance says, we're going to give you all this money, and you're going to take care of these 500 people. And as long as you keep them well and out of your clinic, out of the hospital, you get to keep it all, or we'll give you more. And it didn't work because they said, oh, great, I'm managed. I can go see my doctor whenever I want and as often as I want. The doctor's like, no, that's not the plan. It's like, well, sorry, I called and made an appointment, and I still have this problem. And if you won't help me, I'll just go to the hospital. And the doc's like, oh no, that really isn't good because then I don't get my incentive pay on top of all of this. But yeah, certainly there's some ways for us to try to negotiate better allowances. And so third-party payers, they're not much better. They pay about 60 cents on the dollar. So that can you imagine like going to Walmart and saying, hey, I come here all the time, so you should give me this for 40% off every time I come because I'm in your group. That's healthcare. It's like, we already know that we're going to give a discount on every service we provide. So how do we balance that? We charge as much as we possibly can. It's legally, which kind of sounds ridiculous, but that's what you do. And if the insurance and Medicare and Medicaid and other people say, yeah, that's an allowable charge, but we're still going to pay you 60%, then at least you're saying, well, we didn't charge $1, we charged $1.50. You're paying us 60%. Woo, we get some money on that. That's how we budget. So creative. Any other ideas? 2 providers, 1 office.
We just talked about utilizing networking. So we have billboards that hold the state, what insurance we take, updating websites or the website for the hospital or whatever. Clinic is. So we just talked about
Yeah, just better advertising.
Yeah.
Once again, foot traffic, but also saying, hey, these are the kinds of services we want to provide. We're happy to provide all services, but if we can get more of these services through our door, same patients, but different services, and people are doing that. They'll say, hey, hold on. Right now reimbursement for sleep studies is pretty good. So any patient that looks like they're short, fat, and squatty gets a sleep study. I haven't had one yet, but I probably should. I snore. I have no neck. I have classic signs. So, but I haven't died yet. And my wife knows that I'm more dead than alive, so I don't think she's really She's really well insured if I die. So that's a problem for me. But anyway, what about staffing solutions? So we've got 2 providers, and I don't know who else is in the clinic. You can only imagine they've got receptionists and nurses and medical assistants and phlebotomists. I don't know. So back here.
Oh, so I don't know if this would be possible, but maybe you can open like a small physician office in a highly densated area where there are insured people, and just bring them in. So you go to them and then see if you can open that up and have them come to your clinic.
Great, that's innovation, right? We're not actually going to do all the care there, but we're going to open up a boutique clinic in some place that gets us a little better clientele. And we're going to open up there only 2 days a week, but really we're going to send you back to our clinic and kind of funnel you in there because maybe it wouldn't be our location, we own it, and we're not going to move it, and it's not where it used to be because things grew up and matured around us in the community. So we want to go somewhere else to kind of create some traffic that way. And providers do that. They're going to open up a little clinic in this part of the town because if they can get patients on their panel from that part of town, they're going to make it's worth taking a day and spending over there. And maybe that's a niche that doesn't have those services, and they're good insured people, right? So that's kind of a strategy. Personnel strategies, anything we can do with in the box?
I'm sure these 2 providers aren't identical, so perhaps one is more time efficient, perhaps one is more talkative with their patients. This would be entirely up to the providers, but maybe cut down the time of visit. If the average time of visit is 25 minutes, that's pushing it. That's a long time for that.
Improving throughput. So if you feel like your practice is full, but you're only seeing 30 patients a day, it's not like but it's
for 2 providers.
Well, that's true. And I was thinking per provider, but still, if you were able to say, hey, what would it take for each of you to see 5, 10 more patients a day? We don't have to work more days. We don't have to try to go out and search for better payers. We just need, with our fixed costs, we need to make more, right? Spend less, make more. So that is one strategy to make more. You know, if you're still getting the same low percentage reimbursement, then you know how far is that additional 5, 10 people really going to get you? Is that gonna, yeah, what is that gonna? You know, it's hard to say. And certainly every patient is not billed the same amount. It's based on the services provided. So we can do that. But that is a strategy, right? Work more. Extend hours. That's what a lot of clinics have done. We're going to go into the evening, right? And we're going to do a Saturday morning, things like that. So
we talked about kind of similar, like streamlining some processes or finding out a better way that's smarter in using the hours that you have available for your employees, nurses, and the office staff, so that you're paying total less salaries and wages to cut costs. Or we actually had another guy talk to us a couple semesters ago, and he said one way to always cut costs is look at the staff. There's often somebody that you can maybe let go, and that sounds harsh, but it cuts costs.
Always want to cut people, you know, it's just like we're a people organization. We
All comes to our own.
Yeah, so but that's it. Look at those, and you'll notice a lot of clinics, nurses are expensive. Big for me, right? So maybe you can get by with a medical assistant, not a nurse. Most clinics don't have nurses in them. I don't think. Because I really don't think the patients get the same education, because patient education is a big part of nursing school. Making sure that the patient leaves knowing this is your prescription, this is why you need it, this is where you need to pick it up, this is how you take it. Because they don't always understand that. You'd be surprised there are people with the pills. And so, you have to make sure that education is done well, or they come back in 2 weeks and you don't get reimbursed good again. So it's a challenge. So personnel, looking at personnel. Some is, are your docs efficient? Are they working enough? Doctors, they got a rough life. They do, actually. Doctors have a rough life. And I think we don't give them enough credit. They have a lot of job stress, a lot of work stress, a lot of life stress. In our community, they're all in their state presence here, Rexburg. That's a full-time job, by the way. And then they're running a clinic, and they're trying to see patients, and they're trying to live the life of a doctor, and it gets challenging. But in many cases, doctors are working 4 days a week, sometimes 3.5. So you kind of have to stress, say, why don't you work like the rest of us and work 5 days a week? That would be.
Maybe identify some premium services and advertise on those premium services so that you can attract those people that are seeking those, which are more often than not third-party insured people.
More marketing.
Yeah, I guess along with marketing to those third-party payers, with the time that you do have with patients, you could focus more on like preventative care things, so you don't see them as often. Mm-hmm. You can open up more time slots for what you're marketing for.
Yeah, because those repeat low-paying patients are a bit of a burden. And so, yeah, and that's the part where the provider and a mid-level provider, that's another strategy, is maybe adding a provider to this one. Could you handle another person on another day? On that day when the doc's off and we're still open, we're still paying heat and light and staff, maybe you can hire a nurse practitioner or a PA to be there in those filler times, and we can see another 30, 40 patients. Most times, PAs are able to see, mostly because they take little subacute type patients, but they can see a lot more patients than a physician. Nurse practitioners don't have the same reputation. They actually see less patients, mostly because nurses are more thorough. So we kind of like to see patients as a whole and not just their chief complaint, because we know that body systems are connected, and just because you're here, with an earache doesn't mean you also don't have an infection somewhere else. So let's do a blood culture and let's you never know what you'll find, and those are all the services. Actually, nurses take less patients, but their reimbursement is higher because they actually do, a lot of times they're more thorough. They're not so focused on, you got an earache, go take this medicine. they'll actually do the tests and diagnostic types of treatment procedures. And lab services and imaging services are bread and butter. So, and so skipping over that diagnostic tool is sometimes a problem in healthcare, even though the doctor's right. Culture. Getting that culture is fillable and reimbursable, and that's all important. So,
Well, and is it sometimes insurance needs that proof for the
yeah, it's like we want to make sure they really had an earache or they really had an infection. And you get a culture and it says, yeah, we drew hefty stuff. Yes, we're going to pay for that service. So insurances are really good at denying reimbursement if you haven't documented everything well. And so that's another piece of kind of creativity. Let's make sure that with every patient that comes to that door, we are documenting everything we possibly can. And that doesn't mean upcharging or upcoding, making up stuff that's like going to make it worth seeing them for 5 minutes. It's making sure that we document it well enough to get reimbursed for the full care that we need. So there's some marketing, there's some other strategies.
Well, and to go along with that thought is, has there been an EMR that's been implemented that provides that service?
Yeah, that makes it real easy for you to say, you don't document this, you don't get reimbursed. So, and that's the beauty of EMRs. They got a lot of tracking in them that says, hey, your patient has these values, this diagnosis, this complaint. You should document it this way, and you should charge this. And it's taken a lot of the charge thinking out of medicine in some cases, although they have to document really well to make sure they charge that. So obviously there are thousands of solutions here. I think this clinic is salvageable. If we market it well, we look at our overhead costs, we add some volume one way or the other, whether that's adding staff or reducing staff. There's always opportunities. And this is transformational leadership. You're never happy with what it is. Even if you have a clinic that's doing really well, an orthopedic clinic that seems to just be making money, most people aren't happy. A transformational leader say, how can we do more? How can we do better? How can we never have an infection? Because if you have an infection and that patient comes back to the clinic or the hospital, Medicare and Medicaid won't pay for it. So how do we guarantee that we're not going to have return services that aren't reimbursed? So lots of opportunities. There's some cases where you can be reimbursed more if you have a certain accreditation or certification or met some criteria. And so looking for those kinds of avenues. We don't have to see different patients or more patients. We just need to be able to bill for better services because we've proven through our orthopedic of excellence clinic services that we're better than the average guy. And so now Medicare and Medicaid will give us 45 cents on the dollar instead. So, that's the point with transformational leadership. Is you're not happy with status quo, you have a vision, an objective, you rally people around, you figure out which kind of leadership strategy is going to work in each situation, and leverage that those styles to get the job done and to do better. So I'm going to end on not that. This way. So Christ was the perfect leader. All of you have read this article, right? President Kimball, probably was Elder Kimball, July 1977. He was the perfect leader. You haven't had this in a leadership course. Your professors have failed. They made you buy a book for $100. They didn't show you, what really matters. So the great thing about this talk, if you haven't got it, so look it up. Jesus, the perfect leader, President Kimball. He has fixed principles. He does not vary from his faith, values, beliefs, objectives. It's nice because he knew exactly who he was and what he was here to do, and he didn't necessarily know how to do it. I think that part of it he had to figure out along the way. But pretty fixed principles, which means understanding your core values. Who are you? And you are the same person whether you're on the road to Galilee or you're on the cross. You are the same person. And leaders who vacillate, flip-flop, change parties, whatever, just because of the tide or the season, are not true to their own character themselves. And so that is a challenge. And I just would challenge you as leaders that be the same person. work, at school, in church. One of the things that offends me the most is people that are just not good people at work and pretend to be really good people at other places. And lose a lot of respect for those folks. So understanding of others. Christ was perfectly understanding of others, of course, and he tried to understand others. Dr. Covey, Stephen Covey, had a great principle, was that first seek to understand, then to be understood. And that is a true principle that Christ emulated over and over and over again. He listened. He knew the answers. He knew the best possible solution. In fact, in many cases, he knew the people better than he knew themselves. But he still took time to listen. And that's a key component of leadership. You're smart. You can make the right decision 99% of the time without ever actually hearing all the problems. But listening to the problem, understanding so that people feel heard, valued, and believed is a true principle. Selflessness. If you study leaders, you will find that even though they are strong, charismatic, tall, dark, handsome, jeans stuff, they're selfless. They really are trying to do what is right for their organization, for their people, and not all about building themselves up. That happens because they're good leaders and they're doing the right thing and they surround themselves with good people. Christ was always focused on others. Responsibility. Christ knew what he was responsible for, but he wasn't so proud or proud at all that he didn't give responsibility to people that he knew would probably fail. And giving people the opportunity to fail is huge. People have to fail. But if they're not given responsibilities and encouraged and given the opportunity to learn through those failures, that's hard. He also holds us accountable. The most simple way that we're held accountable to our attitudes, actions, and mistakes is that the Spirit's not allowed to be with us when we make those mistakes. Never out to be with us. That's an accountability. That's being held accountable for our actions, attitudes, and mistakes. And there's no worse way to be held accountable, as far as I'm concerned. You can fine me, you can flog me, you can call me bad names, but to live without the Spirit is pretty dangerous and difficult. And we do it every day. We fail. Hopefully we repent every day, and the Spirit comes back, and we feel it, and we feel more empowered, and we feel more in tune, and we try really hard to not make a mistake again. But he holds people accountable to their actions, attitudes, and mistakes. And time management. What did he accomplish in his 3-year ministry? Kind of a lot. A little more than you will if you BYU-Idaho for 5 years. So I'm a doctoral student at my age. I'm sorry to tell you, that never ends. And it's going to take me, another 3 years to complete my doctorate degree. And I think, wow. If I had 3 years, you did a lot. I'm not going to do anything in 3 years. I'm going to get through a doctoral program, and I'm going to keep doing what I'm doing. But time management is critical, and being in the right place at the right time. Finding the places that you need to be. We all know the few things that we should do every day, and they don't take a lot of time. But you will be given time if you do those few things every week. We know those things, and we know it intellectually, we know it spiritually, and it is just so imperative that we put priorities in our lives so that we get those 5 things done, first thing in the morning, the last thing at night, or somewhere in between. I believe in time travel. I have witnessed that in my life where I can sit back at the end of the day and say, there's absolutely no way I got everywhere I was supposed to be, did everything I was supposed to do in the hours I had. But when you're doing the right thing and you're doing it in the right way with the right purpose, and focused on others, you will be blessed and you will be able to accomplish any goal you set. I've always had a 10-year plan. I encourage you to do it. Write it out. Where do you want to be next year? Be specific. Kind of consecrate that plan. It's kind of the Brother Jared principle. You kind of, Lord says, figure it out. Bring it to me. I'll touch stones if that's what you want me to do, right? But put a plan together. I've always had a specific plan. Where do I want to be? What do I want to accomplish? Some of it's a little superficial. You know, what do I want to make? $1 an hour? Or, and that 10-year plan has never failed me. In fact, I've always accomplished those things on my 10-year plan a good year, 2, 3 sooner than I expected. And so that 10-year plan gets adjusted and moved out. But for me, it was things, what positions do I want to have in 1 year, 2 years, 3 years, 5 years? And how much do I need to make to support my family? What do I want to achieve in those ways? So I challenge you to do that, not in a prideful way, you know, to say, oh yeah, I want to make $1 million by the time I'm 32. Great. But if you have real faith, start paying tithing as if you make $1 million.
There you go. Good call.
You will be blessed. Poor and probably homeless. But you know, have faith that if you consecrate your plan and you put your effort into it, you do that. So obviously, the principle of transformational leadership is something that I live by. And if you haven't heard transformational leadership, it was kind of a fad. I mean, it's real, but I think it has some very specific principles and characteristics that if you follow, and Christ demonstrates them best better than any great leader out there. And so the nice thing about healthcare is it's very spiritual. You're touching people's lives. You're there at their most vulnerable points of life, whether they're sick or dying or having babies or whatever, and that's pretty cool. And as messed up as healthcare is, every day we get to do really, really important things. And we save lives, and we make lives better, and we allow lives to move on and move forward. And so I think don't get frustrated with the news or the politics of healthcare, because it'll always exist. But we can, and I have so much hope in your generation of healthcare leaders, move us to a place through legislation, through practice, through policy, to be a better place for people to receive healthcare, and for people to understand it and be able to navigate healthcare in a way that's easier and simpler, and we all do that. So that's it. Any questions for me? I didn't do too bad, but I did finish my first part in a half hour, which I'm going to tell my wife. She's going to not believe me, but that's okay. You have any questions for me? Or you can just leave. I'm not a
What drew you to this CNO job over here at Madison?
The money. So I tell you, I lived on the coast of Maine for a couple of years. So my career was 22 years in nursing leadership with Intermountain Healthcare, 2 years full-time at BYU, was bored. Knew I wanted to get back into hospital administration, and this little gig came up on the coast of Maine. I served my mission. So kind of a dream. My wife wrote to me my entire mission, so I kind of fell in love with her in these places. And I wanted to go back and create this romantic situation that didn't happen. But it was a great idea. So there was this great opportunity to go back to Maine and be the chief nursing officer of the whole hospital back there. It was a little struggling, community-owned, really different critical access hospital. I'd never worked in that smaller environment, that remote, but it was beautiful. And so I went out there and took that on for a year and a half, did some really, really good things. But life is here. My wife's from Southern Idaho, I'm from Utah. We got married, kids, BYU, Provo. The youngest is a missionary, he'll be home in a couple months. And we just thought, we can't. This is very irresponsible of us. We were living the dream. And we lived on 14 acres of oceanfront property.
Oh.
50 yards away from our big bedroom window was the ocean. Oh. And it was pretty dreamy. And the hospital was doing okay. And the community was great. We had 40 people coming out of our branch, every week we were doing golf. It was just kind of a really cool experience, but it was too far away. We were missing things every week, every month. There was some family thing we were missing. So wasn't really looking, but this job came up, and there are really only maybe a dozen hospitals in the country like Madison Memorial. It is county owned, physician-driven, run by nurses. That is the and in a community that's pretty well to do, and most of you are insured, and so it actually makes money. We're a county-owned hospital that takes no tax dollars. In fact, we give back to the county. That's the rare part. Most government-owned hospitals are a burden on the community, and so that's what's a little bit different about this hospital. So, as I saw this job and kind of researched it and took a look at it, thought, well, it's still 3 hours away from our kids, which is a really long way from my wife and not nearly far away from me. but it's good. That's what really appealed. That's a really long answer.
All right, that's a good answer. Let us know a little bit about yourself.
You mentioned earlier about wanting to have like a yearly goal for salary.
Mm-hmm.
Being in this area, like, what do you think a good number would be like that for here? Because obviously the markets are different between other states.
Yeah, it's low here. It's hard. In fact, it was shocking coming from the East Coast because it was like, what do we pay these people? Like, is that legal? I mean, so obviously it so varies, but I'm going to tell you kind of frontline manager, right? Supervisor. So find, and really your entry level with a bachelor's degree or honestly even a master's degree is not going to be the leader of a department right off the bat. You got to get in and get some experience. So, so find an entry level job in billing, housekeeping, any way to get into healthcare. Figure out a way to get in and then look for those opportunities in leadership, supervisor, manager. But frontline manager, leader, and this is frontline, okay? So, you're talking 45, 50,000. It's not awful, but it's new. And then, if you're over multiple departments, then you're going to be pushing that 60, director level, 80, administration above that. And some of that is experience. It's years of experience, it's education, it's what you bring to the table. Do not be offended to negotiate. But here's the secret. Whoever brings up money first loses. So when you're interviewing for a job, once they've gone to the effort to really like you and want you, then you're in transport. Negotiation. It's the only time you'll ever use it. And mostly it's just paid cheap. So don't read the whole thing, that'd be a waste of your time. So, but you really don't be afraid to negotiate and say, hey, I'm worth more or I want more. The worst they can say is no, this is it. This is all we're going to pay. But certainly don't be afraid to negotiate that. But part of it is that experience, training, education, certifications. If there's a way for you to get certified in some kind of a business leadership, lean strategies, green belt, black belt for improvement, there's a lot of things to do to build your resume to make you more marketable. That certainly is doable. But it's not awful wages, but you may have to work beside you. So I've always had 3 jobs. I think I have 2 right now. I'm kind of worried about my other job. Like, where else should I work? But so I've almost always taught on the side. I'm not currently teaching. I'm doing some but I've always taught on the side. I've worked in nursing administration or hospital administration, and then I do some surveys with hospitals. So I'm a hospital accreditor. So it's kind of a side gig. They're not obviously all full-time jobs. That would be crazy. I shouldn't have to do that. But in some cases, you have to work, more than one job. And I know some people just think that's crazy. You work 40 hours, and why should you work more than that? Well, because you got to make ends meet. You got to make your goals. So putting that 10-year plan together is not just going to magically appear. You're going to have to put some effort into it. And so early in my career, I worked at the hospital, and I moonlighted at the care center. I worked 60, 80 hours a week, made ends meet. It's good. My wife's an accountant, so she manages it all. I don't know where it goes. She won't tell me. She says if she dies before me, which is unlikely, just talk to our financial planner. I'm like, I don't need to know. It's better that way. I can buy a car. Anything else?
What would you tell people that are looking for internships in the
Look for ones that pay because they are out there, and there's some great experiences. If you have to go live somewhere else for a summer, for a semester to get that experience, it's a great experience and it's worth it. And if that pay only covers your costs to get there and survive there for a semester, it's a really good experience. We're just talking with John. We're trying to build some internship programs at the hospital that pay, but we don't have any yet. Michael works.
I work for a pet.
He doesn't eat donuts. Look at it.
And I think to go with that, it also kind of goes into what you want to end up doing. If your goal is to go to a master's degree, obviously that should be part of your goal to what type of internship you want to have.
Yeah, and there's a lot. There's a lot of types of internship, and even if you had to take a free internship, I mean, it's not like it's good experience, and so. But I would absolutely encourage that. I know your faculty here encourage it, but there's some good, and I don't think there's a bad internship. I think it's what you make it. So get in there and just learn every possible place. And if the internship ends up being like, gosh, I just didn't following this guy around, then challenge that and speak up. Say, I would like to see lab services. I want to understand pharmacy. I know nothing about imaging X-ray equipment. Can I spend a day down there? They're probably going to be happy to cut me loose to spend a day somewhere else with somebody else. And so you have to be a little assertive, if not even slightly aggressive, to make your experience what you want it to be. So don't be afraid to speak up and make it better.
Should we, do you recommend with the master's program working a little bit before after our bachelor's or just right at it?
I don't know if it matters. Really, you need to get some experience, and however you're getting that experience, I think is okay. I hate to tell people don't. I've had nursing students that have graduated in the spring, got into a NP, nurse practitioner program in the fall, and have done fine, and they're working a little bit, as a nurse along the way. So if you can afford to work and get some healthcare experience as you're getting your bachelor's like you are, or master's, then absolutely that's fine. So is it so I should know that. You know it. It takes out my turn. So I didn't know that, but I appreciate it. No, I can know that. So I think Jacob's director started out as a volunteer at the hospital, and then took a unit secretary position, unit clerk position in BYU. Was a BYU-Idaho student. This is Kyle. Graduated with a bachelor's from here, and we had an opening for our volunteer coordinator. It was leadership, it was management, it was over volunteers. So it's not managing, of course, it's managing over people. So in some cases, there's young volunteers too, but that was his leadership position. He was managing the volunteers and went back to graduate school, and he did such a great job with our volunteers and all of that organization. And some of it was our student placement and our internships and things like that. But there became a position open in food services and dietary, and he was still finishing his master's degree, and he took what I call a real leadership position as the manager director of food services and dietary services. Finished his master's, has done great things. You're eating at the, what's it called? Paragon. It's good food, and it's really fairly inexpensive. And he's done a great job with that organization. And recently was promoted to an executive director, and he's over food services and housekeeping services and lab and imaging report up through him. He's a non-clinical guy who kind of grassroots right here was sitting in his classroom, 6-7 years ago, and has done really, really well. But it's because he was willing to take that entry level position, willing to take that manager leader job that didn't seem very exciting, and then really, really performed well. And he's one of our go-to. I mean, you want something done and you want it done right, he's really, really good. And so for me, it kind of gives us all a little bit, okay, we can accomplish something in our lives. But there's lots of those opportunities. And with your degree, there are lots and lots of management positions outside of hospitals. There's clinics, insurance companies, a lot of things that are healthcare related nowadays. Managing a fitness center. I mean, it's healthcare and healthcare products and lots of things like that. And so don't get stuck with, just because you're faculty, you're all old hospital administrators. Because I am one. But that hospitals is where healthcare leadership happens. Because healthcare leadership happens in a lot of avenues. Boutique shops,
long-term
care clinics, all varieties. The challenge that I have sometimes is, there's like 5,000 real hospitals in the country, and there's 5,000 healthcare management degrees offered and graduate every semester. Well, you're all not going to every semester to replace somebody running a hospital. That's just not going to happen. However, hospital administrators like this service is around 5 years, which really sucks for some of us. I don't know why it's tough. And that's average, right? So somebody lasts 1 year and others last 15. So it's a hard market sometimes. All right, I'm going to cut you loose. Thanks for your participation.